Hi, my name is Debbie Casey,
And I'm Shannon Doherty.
and we're the PMA instructors of IoT Clovis. And today what we're going to do is show you some of the fun things that we do in our laboratory. The first one that we're going to demonstrate for you today is going to be an intradermal injection. We're going to start off by drawing up our injection. We have our medication here. We're going to give it one wipe. And the reason that we only give it one wipe is because once you have cleaned it off, if you go back and you repeat, what's going to happen is that you just recontaminate the bottle. We're going to uncap our needle, and for however much we're going to draw out, we are going to inject in air into the bottle. The reason that we would do that is so that it equalizes the pressure. Whenever we go to recap, you never want to use your fingers. You always want to swoop it in and then secure the lid. When I'm getting ready to do this, an intradermal would be used for a couple of things. It could be for a TB skin test, which is probably the most common. But aside from that, they also use this for testing for valley fever and also to check to see if someone has immunity to the mumps. I'm going to look for an area on her arm that's not very vascular. And what I mean by that is not real veiny. So I try and avoid the veiny areas. We want to try and stay away from the wrist area or up too close to the antecubital space, which is up around the crack of your arm. The first thing I'm going to do is cleanse the area. And I'm going to let it air dry rather than recontaminate it. When we go to inject, we're going to hold this a little bit differently. We're going to hold it from the sides, kind of like if you were picking a pencil up off of a table. We're going to pull from above, and we're going to inject just the tip. And right underneath, we're going to inject just a little bit of medication. We have a safety device that you will cup over the top of the needle, and then you dispose of your needle. We're looking for something that kind of stands up a little bit so that we can see that it's formed a little bit of a pouch just underneath the skin. And here is intradermal injections.